Hi, my name is Sarfraz Aly. I'm the infectious disease specialist at OakBend Medical Center, as well as the Sepsis Committee Chair member. I wanted to introduce myself as well as let you know that this is the month of sepsis, and we're trying to inform patients about sepsis as well as the complications. Every year, every 2 minutes, patients die from sepsis in the United States.
What is sepsis?
So sepsis is the body's overwhelming and life-threatening infection that occurs when a patient has an illness. It starts from tissue damage, organ failure, and ultimately death.
What are the signs and symptoms?
So signs and symptoms of sepsis varies different from patients to patients. It includes fever, body temperature can be up or down, as well as rates of the breathing can be increased, heart rate can be increased, as well as patients have change of mental status.
Who is at risk?
Everyone's at risk. It could be from young to elderly. However, patients present differently. Some patients present with altered mental status, some patients present with blood pressure issues, but every individual who has a heartbeat is at a risk.
How is sepsis diagnosed and treated?
So most sepsis is diagnosed through a series of clinical findings such as fever, blood pressure lowering, as well as heart rate and difficulty breathing. Some other ways of diagnosing sepsis is labs. We order lactic acids, blood cultures, urine cultures, as many other cultures and labs to help us identify patients with sepsis.
What are the long-term effects of sepsis?
So patients who've been diagnosed with sepsis, first and foremost, we have to make sure that they're treated adequately. We have to treat them within certain hours to meet the sepsis guidelines, sepsis protocol. This will help them reduce the side effects, reduce the longevity, reduce any kind of risk later on. Most patients can develop debilitating conditions, be bedbound, have mental status changes that are permanent, even have end organ failures.
What is OakBend doing to prevent sepsis?
So OakBend has an initiative that has been started where we try to recognize sepsis the moment it walks in through the emergency room. Within hours, we are making sure that patients are adequately assessed, treated, as well as given antibiotics. Cultures are drawn, as well as all the parameters that are recommended by Infection Control Society, as well as Critical Care Society. We are making sure that patients are adequately managed. We're educating the nurses, as well as the patients, as well as the team members to help us fight sepsis aggressively. I hope you understand that sepsis is the leading cause, or is one of the leading causes, and this is preventable if it's caught early. And I'm hoping that this is informative to everyone that's watching. Thank you.